Absolutely. Absolutely.
Okay, you are number 11.
All right. So another thing to think about is the sounds. I mean, being in a dental office can be stressful enough for a lot of people and uncomfortable, but the sounds, the drill that we use, the hand pieces that we use is such a negative sound for people, especially if they have any concern with being there. And so really listen to the sounds. And I go into a lot of practices as well. I'm sure, Laura, you've been in some too, where it's like you walk in and it's just like there's all these different sounds coming from all these different places. We've got a radio playing, and we've got a TV on in the reception area, and then TV's on in every operatory with the sound on. Plus we can hear, the autoclave running and the ultrasonic cleaner, and then maybe a hygienist who's using an ultrasonic scaler, and the doctor's using a hand. There is a lot of sound, and it's hard to get rid of that. And one of the things that we can do is to just mute things down a little bit and really make sure that things are soft as far as the music that's playing and that kind of thing. So be very careful about the sounds and pay attention to what patients might be paying attention to.
Exactly. That's why we have doors a lot of times between the front and the back. Use them, right?
Yeah, for sure.
Okay, good. So mine also is sound, but mine is going to be specifically about one topic, which is really about the televisions and what gets viewed in the dental office. There are a lot of negative things going on in the world. There are things that it's just sad. There's controversy, there's politics, there's just a lot of stuff going on. But when we allow it to come into the office, it's going to filter in. We hear it on the radio on the way to work. Your patients hear it. But if you have things in your office that brings it to them and serves it to them on a platter to say, here's something that's going to put you in a bad mood, that's not what you want, because we're already in an environment where we're going to put drills and needles in patients' mouths, and they're going to pay us a lot of money. It's not the most fun. It's not like they're sitting around at a coffee shop. They're already stressed. And then if you have TV on that's inappropriate. I mean, I sat in an ortho office recently and they had Jerry Springer on and it's not appropriate. Don't put news on. If you're going to let them watch TV, let them watch things that are going to help them lift their mood so that we can get them in the best environment and the best mood possible.
Absolutely. Absolutely.
All right, you're up.
All right, here we go.
I couldn't get over this the first week I was in the office, so I can't wait till you talk about this.
It's tough. It's tough. So let's talk about one more sense that we all have, and that's our sense of smell. I think dental offices have a very, very particular smell. And I don't know what it is. It's a combination of like all the materials that we use and that kind of thing, but it just does not invoke a nice feeling in very many people. And we all know that a lot of our memories and the things that our autonomic responses are tied to our memories, and smell is huge for connecting that. And so I typically recommend, I recommend against a heavy scent like super floral or sprays, that kind of thing. Of course, diffusers with essential oils are very popular right now. I would just go very, very light on the scent and do something very like fresh, like a citrus smell as adverse to lavender. A lot of people don't love lavender and floral scents. So really pay attention to that too.
Awesome. I agree. Smell dental offices, you can smell that smell.
Yeah. Ooh, awful.
All right. So mine is about professionalism. And again, it's not necessarily the paint on the wall or the posters on the wall, but I'm talking about the team again, because I focus on that. The professionalism of what's being talked about. Patients can hear more than we know. You can hear from one operatory to the next, what's happening in the next operatory over. You can hear what conversation's happening in the break room. You can hear what's happening by the lockers, what's happening in the sterilization area. That patients can hear it and they can feel it, okay? Even if you're doing it and whispering, patients feel it. So make sure that you're always being professional. You're talking about topics that I always say, you're talking about topics that you could say to your grandma, right? Let's not go talk about you going out and drinking too much last night or gossiping about people. Let's talk about positive things. Let's be careful not to go down the political route. Let's be careful not to go down the religious route. Let's keep it to a topic that's going to make everybody leave with a positive experience and not a negative one.
Absolutely. Absolutely.
Okay, oh, I love this one. Ready? All right, go.
All right, here we go. So it's important to refresh your decor. A lot of times practices will be telling their patients, the words that they're saying is that we're high tech and state of the art and we have all this technology and we're super duper. But yet you look around and their decor hasn't been updated since the 90s, or perhaps it hasn't been updated since they moved into the building, 5 years ago or 10 years ago. I believe it's important to refresh that on a regular basis. It doesn't mean you have to go out and buy all new furniture every time. But one thing that's a very fast, inexpensive update is to update your paint in the office. Avoid super fancy painting like faux painting and that kind of thing, because that's harder to refresh. But rather just have nice, solid, neutral colors. And I have teams on picking those colors. And refresh it every 2 to 3 years. Always have touch-ups available, but every 2 to 3 to maybe 4 years, refresh the entire office with your paint color or paint. I'm sorry, the paint itself, even if it's the same color.
Got it. Love it. Especially because we don't realize how many nicks and chairs and things that bump into the walls.
Yes, absolutely.
Okay, so my next one is, I want to hashtag this one. Ready? So if you would like this and you agree, put hashtag stop the whisper. Okay, stop whispering. There's absolutely no reason that there should be any whispering in the office. And when I've been in offices and I ask them, like, why are you guys whispering? Oh, we're talking about the patient. We're privacy. We want to make sure that we're talking. And what I see is a lot of times, like, the assistant and the hygienist go behind the 12 o'clock to talk to the doctor about something they really should be talking over the patient about, right? The patient is worried about insurance or money, then we need to have that conversation with the patient. When we're talking about a patient in the back and you come up front, we need to be talking, again, professional enough that you don't have to whisper. The reason is, no matter what you're talking about, if anybody sees you whispering, think about yourself back in high school. If anybody sees you whispering, what do you automatically assume they're talking about? You, right? And it causes drama with the team and it doesn't make the patients feel comfortable. So find ways to hashtag stop the whisper.
I love that. So great.
All right, you are awesome. Up. Ready? We're almost.
I'm ready.
Halfway. Okay, good. Go for it.
All right. So you know how at home we all have that room that we would throw things in when we've got some friends coming over that we haven't seen in a while or something like that, and we throw all of the junk into one room, or we throw it into a drawer or whatever, and we close the door, right? And when we have friends that are coming over, we do a deep clean in our house, and we do, we go around and straighten up and do a deep, we vacuum all the crevices and wipe down the baseboards, or at least I do. You do that deep clean, right? Well, one thing we have to remember when we have a public business is that company is coming every single day. So company is always coming, and every single time you walk into your practice, you should look at it like as if, oh my gosh, company is coming. It's so funny, as a consultant, I would come into offices and teams would tell me, oh my gosh, the doctor just cleaned their office because you were coming and we just love it. It's so nice. And it just cracks me up because we need to be that way every day. Every day, right?
Exactly. I don't do the baseboards. I just want you guys to know, if you come to my house, I'm not dusting the baseboards.
That's funny.
Okay. Good. And so Andrea and I both talk about this because we think it's important. And honestly, for me, it's the furniture, and make sure that it is up to date, I guess I would say. So your patients are judging you. And I've walked into tons of offices where it looks like that couch was purchased in like the 80s. I understand it was pretty when you got it and it looked good when you got it. You've gotten satin in a million times. It's faded. There's blue jean marks on the the fabric. I know you're used to it, but it doesn't cost much to go to Home Goods and get a new chair, or go somewhere and just replace one every 6 months to give, your team's going to be more excited about it. There's going to be some freshness about it. You're going to be more proud of it. And I know the way it looks is what you're comfortable with, but it's okay not to break the norm. It's okay to freshen it up every so often. And if I walk in your office and think it looks like it was decorated in the 80s, I'm going to assume your dentistry is from the 80s too.
Exactly.
That's okay, good. All right, we're almost halfway now.
Now we're getting there. Okay. We're getting close. All right. Clean up the clutter. Oh my gosh. So horizontal surfaces, if there's things on them, even if it seems to you like it's in an organized fashion, it can only read to a patient, it reads as dirty because they don't know how fastidious you may or may not be in cleaning every single thing on the countertop. So horizontal surfaces should be fairly cleared off, even in the front, not just in the back. I think in the treatment rooms, frankly, they should be 90 to 100% cleaned off, zero, nothing on them. Get your gloves up off of the counter, put them on a wall, get wall mount stuff. Your disinfectant wipes and sprays, all of that should go below the sink. Paper towels, everything. The only thing that should be on that countertop in the treatment room is what's pertinent to today's appointment. So 100% clean is the goal.
There we go. And I know that's hard to do. I've said it enough, but it's important.
It is.
Okay, so now mine is about the environment when it comes to noise again, but mine's going to be telephones ringing. And I actually just did a video for this for my YouTube channel because there are too many phones ringing in dental offices that aren't getting answered, or they're ringing and ringing and ringing and ringing and going to voicemail. And I have a whole thing about why that shouldn't happen. That's a whole different topic. But when it actually comes to the environment for the patients in there, have you ever been someplace where the phone's ringing and they're ignoring it? Like, it's annoying, right? Especially, hopefully your phones are ringing 2 or 3 lines at a time. And if you're not answering them, if you're just letting them go to voicemail, there's multiple reasons for needing to answer them and should be answering them. But for your patients, it's annoying. It's just one more noise that Andrea was talking about. So you should be answering your phones by the 2nd ring. 3rd ring at the ultimate worst. And if you can't do that, then you need to find a way to get your phones answered because it's just one more noise that's annoying to the patients in the office.